Hello and welcome to another learning adventure today. Few facts in this discussion today was new to me too, and I thought of sharing it with you all. Let us now look at the question. A 36-year-old male is in the emergency department with his girlfriend with symptoms of nausea, feeling tired, and tremors for the last 2 days. He denies any other symptoms. His observations are blood pressure, which is normal, heart rate, slight tachycardia, saturating 98, respirate 13, and temperature 37. On assessment, there are fine tremors and myoclonus of the thigh. His VBG is given as available. His bipolar disorder is well controlled with his medications. What is the next best investigation to consider? So that's the blood gas with a pH of 7.32, PCO2 which is normal, PO2 which is normal, sodium which is normal, potassium which is 4.2, chloride 100, bicarbonate 26, and anion gap of 6. So these are the investigations which could be the next step. That's ECG, free T3, T4, and TSH. Repeat the venous gas, serum lithium levels, or urine anion gap. So let us read the question without the gas now, because everything looked normal on that except for anion gap, which was mentioned as 6. 36-year-old male is in the ED with his girlfriend, symptoms of nausea, feeling tired, tremors, and positive finding was tachycardia with some fine tremors and myoclonus of the thigh, has a bipolar disorder. ECG, free T3, T4, TSH, and repeat venous gas, serum lithium levels, urine iron gap. So guys, you can pause over here and take your time to answer the question, and let us see what the right answer is. So let's talk a bit about lithium, because there was something mentioned in the lithium in the option lithium. Lithium is a drug used in manic disorders or schizophrenia. It has a narrow therapeutic index. We all know that it is a drug which has a narrow therapeutic index, and toxicity can also occur in normal doses. So a patient is taking a normal dose and is maintaining well, but still can come with a toxicity. And levels, that's why they check the levels every 3 months, and levels greater than 1.2 milliequivalents can give symptoms. How do I remember 1.2 as a threshold? If you remember the ankle brachial pressure index, 0.9 to 1.2, greater than 1.2 was the problem. So the same way over here. There's a mnemonic LMN OPS. So lithium, muscle tremors, nephrotoxicity or nephrogenic diabetes insipidus, hypothyroidism, pregnancy. In pregnancy, it will lead to Epstein's anomaly in the baby, serotonin syndrome. Okay, what is Epstein's anomaly, guys? I usually do not like these eponyms, but that's been there traditionally. So what is Epstein's anomaly? So Epstein's anomaly is something we call it as ventricalization of the right atrium. So what happens is the tricuspid valve does not develop normally, and it is way further down. So the atria looks like the right ventricle. The right atria looks like the right ventricle. If you go online and check for it, the images, you will understand it, and then you'll be able to remember it. So the mnemonic is LMN OPS, narrow therapeutic index, level greater than 1.2, can give symptoms. Another fact check over here: cations such as sodium, potassium, that are not routinely measured, such as lithium. So lithium is actually a cation, can result in a low or negative anion gap. Low or a negative anion gap. In the right context, in the right clinical context, a low anion gap should prompt serum lithium testing. That's from the journal article in 2023. So let us see the right answer, and it is serum lithium levels. Homework for you guys is, when do we check a urine anion gap, and what does it signify? If you're liking these videos, please put in your comment below, and please thank you for watching it. If you could consider joining my channel, please do consider clicking on the join button. Otherwise, please share, subscribe, like. It helps to spread the weaving across the globe, and many patients may be benefited, many doctors will be benefited from this information. Thank you, and peace.